Next up is House File 1857, Representative Smith, cats. Elective declawing of cats.
I can't just start talking about cats for the next hour.
No. Representative Smith, would you like to move House File 1857 to be re-referred to the Judiciary, Finance, and Civil Law Committee?
So moved, Chair.
Representative Smith, to the bill.
Hi there, members and Chair. Thank you for listening to this bill. I want to first talk about that motion of moving it to Judiciary, and I will be open to you that I do intend to try to pass this bill. It's a standalone. One of the reasons is the feedback I've gotten from members of this committee. Last year, a version of this bill was part of our agricultural omnibus bill, but it was stripped out of concerns that it might be a slippery slope towards some other things in the area of the Board of Animal Control, like livestock dehorning. And so I want to say very, very clearly that this bill does not have any interest in this, and truly my focus is only on stopping the suffering of cats based on this one procedure and wanting it to be outlawed in our state. I heard those concerns. I want to respect them, which is why I'm trying to move this as a standalone so it's not part of our agricultural discussions. So clearly, the legislative intent of this bill, it's only focused on prohibiting elective cat procedures, not on animal or livestock regulation or any of the scope of the Board of Animal Health. Now to the bill itself with that long preamble. The research and science is clear that elective cat decline is harmful to cats. It can cause chronic and acute pain, long-term musculoskeletal change, and increased aggression and biting, along with a host of other possible side effects. However, this bill still gives veterinarians the discretion to use a declaw procedure in the instance that it's medically necessary for the feline patient. This bill doesn't limit a vet's scope of medical practice. It simply outlaws a harmful practice that good vets aren't doing in the state of Minnesota right now. I'll leave Dr. Gaskin to talk about the science more generally, but there is a growing global agreement that this is not an acceptable practice. Elective cat decline is outlawed in 6 states and Washington, D.C., as well as several Canadian provinces. It's outlawed in the European Union, including the United Kingdom, in Australia, Brazil, Israel, and many other nations. Veterinarian schools, for the most part, don't even teach this procedure anymore. Policy positions against elective cat decline is published by the following organizations: the American Animal Hospital Association, the American Veterinary Medical Association, the American Society for the Prevention of Cruelty to Animals, the Canadian Veterinary Medical Association, the American Association of Feline Practitioners, the International Society of Feline Medicine and International Cat Care, the Pet Professional Guild, and the National Animal Care and Control Association. The National Veterinary Associates, which operates 1,400 clinics, including approximately 10 here in Minnesota, have stopped providing decline surgeries as of February 1st of 2025, joining many other large veterinary providers. In their decision, the NVA said, and I quote, "As a company committed to evidence-based medicine, the research has made it clear that elective decline creates risks of chronic pain, behavioral issues, and mobility problems. With mounting evidence of long-term harm to feline patients, we determined this is the right step forward for modern, compassionate medicine and animal welfare," end quote. Last year, the American Animal Hospital Association, which accredits veterinarian hospitals based on high-quality standards of practice, revised accreditation guidelines and now requires hospitals to forego declawing cats for non-medical reasons in order to maintain accreditation. There's a widespread agreement that this procedure is not good for cats, not good for cat owners, and in Minnesota, we love our pets, and we should be part of the growing consensus around this issue. I'll close with a personal story, because I also want to make sure that this bill is not presented in any sort of judgmental space. I grew up in a family that had several family cats. One of them was named Sugar. She was a beautiful white cat, and when one of my sisters was born, out of an abundance of caution and talking with a vet, my parents made the hard decision to declaw Sugar. And she did change quite a bit, and unfortunately, died a couple years later, and she was changed. She was different. And I mention that story just to say that many cat parents or families have made this decision to declaw cats based on information they've gotten from vets, or vets have given best practice. This is a relatively new procedure from 1952, and this is not a judgment on those cases. This is simply a fact that we have new evidence. We have new research that shows how harmful this is to cats, and so we should put a stop to this practice. So thank you, members of the committee, for listening to this and hopefully allowing me to bring this to the Judiciary Committee.
And we have several testifiers. So first up, Ronald W. Gaskin, Main Street Veterinary Service. Welcome to the committee, and state your name for the record.
Thank you, Mr. Chairman. I'm Ron Gaskin, owner and operator of Main Street Veterinary Service, and in full disclosure, I am Minnesota Paw Project Director. I'm here in support of House File 1857. I've been a veterinarian for 42 years. I have seen firsthand the functional damage caused by declawing cats. Declawing modifies how cats walk and forces them to walk directly on their amputated toes. The resulting pain and redistribution of weight increases the chance of hip arthritis and lower back pain. That's documented by evidence. When bone fragments are left behind, which is a frequent post-surgery finding, the pain is intensified. Ongoing pain can trigger aggressive behavior, elimination outside of the litter box, and biting. Since 1951, this surgery has been done in ignorance of its anatomy and long-term effects. The phalangectomy surgery, I'm not going to be euphemistic here and call it a declaw because it's a phalangectomy. They take off the whole tip of the finger. It's a phalangectomy. Surgery method has evolved and pain control has evolved, but paw anatomy is the same. About 33% of declawed cats will manifest unwanted side effects in their lifetime. Veterinarians are not checking declawed paws for problems during physical exams. By swearing the AVMA's veterinarian's oath, veterinarians declare that they will prevent and relieve animal suffering. Performing a painful elective procedure that provides no medical benefit to the cat for the convenience of an owner inflicts suffering rather than preventing it, and therefore violates the veterinarian's oath. The Center for Disease Control also does not advocate for declawing of cats, even if they live with immunocompromised owners. The CDC realizes the declawed cat bite is far more dangerous than a cat scratch. Cat's claws can be trimmed regularly. The University of Minnesota no longer teaches declaw surgery. Scratching is a normal behavior for cats. The new veterinarian has a toolbox of behavioral modification and redirection techniques to prevent unwanted scratching behavior. A cat's claws can be trimmed and are coated with a plastic cover, especially as young kittens. They're still learning the rules, just like our kids. And you can cover these claws temporarily and redirect them to appropriate scratching surfaces. Just basically identify whether they're vertical or horizontal scratchers. What's their preference? Educating cat owners is key. The elective declawing of cats is unnecessary. It's cruel, and with your insight and wisdom, it should be banned and show the enlightenment of the state of Minnesota towards our cat companions. Thank you, Mr. Chairman and the committee, for your time to present today.
We'll go through all the testifiers. Dr. Peter Memon, Minnesota Veterinary Association. Welcome to the committee. And state your name for the record. Welcome.
Thank you, Mr. Chair. And my name is Rob Memon. Just to correct the record on Peter, it's Robert Memon. I'm a resident and a practice owner in Minnetonka, Minnesota. We're a small animal general practice that provides general medical surgical care for cats on a daily basis. I'm also the most immediate past president of the Minnesota Veterinary Medical Association, which I'm here representing today. And so I appreciate the time and the opportunity to share our association's stance on this issue. I'd like to start with reading our MVMA policy on elective declawing, and then share some facts that some of which overlap with what's already been presented, and then our position on the proposed ban. So first, our policy statement. The MVMA recommends that elective declawing of cats be strongly discouraged unless the procedure is medically necessary as determined by the attending veterinarian. The elective declawing of cats provides no animal health benefits and is strongly associated with negative animal health and welfare outcomes. Veterinarians should educate their clients about normal cat behavior, details of how the procedure is performed, health risks of the procedure, and long-term negative outcomes, and of course, alternative management options. Now, one thing I think is important to note, the language you use in our policy, such as we strongly discourage unless medically necessary. If you look at the American Animal Hospital Association or the AVMA's positions, you'll find very similar language, not necessarily prohibiting language, but strongly discouraging type of language. So I think we're very consistent with what some of these national organizations are recommending and their views on this issue. So some facts to consider with this context. As mentioned before, Minnesota's veterinary medical school is no longer teaching this procedure as part of its training, and a decreasing number of veterinary clinics are offering to perform this procedure entirely. Veterinarians are trained to distinguish between medical and behavioral conditions and provide appropriate client education and counseling. Comprehensive client education commonly changes an owner's desire to proceed with a procedure in the first place. Veterinarians are committed to informed consent and thorough discussion alternatives, regardless of whether or not they elect to perform this procedure. And they may consider claw removal in limited case-specific situations that involve factors beyond a medical diagnosis for the cat. So examples being situations where behavioral modification strategies to address destructive scratching are ineffective, owners who are elderly, disabled, and may have special needs, owners who are immune compromised and are more susceptible to infection or illness as a result of a scratch. We also believe current surgical techniques and modern anesthetic and pain medications have greatly reduced the pain and discomfort and negative outcomes associated with the procedure. And for some households, unmanaged behavioral concerns or concerns about human health might contribute to decisions involving relinquishment or even euthanasia. And so as veterinarians, our aim is to provide options that support animal welfare while also taking into effect we need to address these circumstances to reduce the rates of relinquishment or certainly euthanasia. So as an association, our stance is, regardless of personal feelings about the procedure, even amongst our members, the decision to perform a treatment or therapy should be made on a case-by-case basis between a veterinarian and a pet owner. So with that in mind, when we look at the proposed bill in House File 1857, it does bring up some serious concerns that would cause us to oppose it. First and foremost, it removes the veterinarian's and the client's right to choose whether to perform a surgical procedure. We believe it's fundamentally unnecessary because the veterinary medical profession has appropriately regulated itself moving away from this procedure over the years, and it continues to do so in a thoughtful and compassionate manner. We don't think it considers the legitimate medical conditions of the animal owner when banning the procedure for reasons other than the therapeutic need of the cat. And then finally, we believe it sets a dangerous precedent in legislating what surgical procedures a veterinarian may perform in general. So I appreciate you guys hearing our thoughts as an association, and I'm happy to answer any questions you may have. Thank you, Mr. Chair.
Next up, Megan Hamilton, Basil's Cradle.
Thank you. Hello, my name is Megan Hamilton, and I'm the founder of Basil's Cradle, a 501c3 nonprofit sanctuary for special needs cats. I'm here today to urge you to make sure that HF 1857 passes and that the penalties are not removed. If there are no consequences, such a prohibition is pointless. Cats will continue to suffer, and nothing will have changed. That would counteract the goal of this bill, whose objective it is to stop elective declawing. Declawing has no medical benefit to cats and causes cats undeserved, unnecessary pain and suffering, not to mention abandonment when the all too common unwanted behaviors such as biting and inappropriate elimination eventually occur. My experience regarding declawed cats and the cruelty involved in this procedure spans many decades. I'm 66 years old. I've been rescuing cats for the past 48 years. Many of these cats were declawed and then abandoned. I have and continue to witness the damage that amputating cats' toes causes. I and many other rescues help those we can, but we can't save them all. And the declawed cats we do save often stay in rescue and are never adopted out due to the behavioral issues and extreme costs that we work so hard to manage. These cats were discarded and left either on the streets or abandoned at animal control or shelters like damaged goods. The majority of them are on lifelong medication to manage the irreversible pain they experience and/or behavior drugs such as Prozac to mitigate the resulting unwanted behaviors and psychological damage that they really, truly do suffer. Many veterinarians who still practice declawing justify it by claiming that declawing will keep cats in their homes and they won't be euthanized for unwanted behaviors. This is an easily disproved myth. Many declawed cats end up abandoned precisely because their owners do not want to deal with their behavioral issues after declawing. Many lose their lives in shelters when they are deemed unadoptable due to declawed-related behaviors such as biting, not using litter box, and instead urinating on carpets, beds, and furniture. Those cats that end up in rescue generally stay in rescue due to behavior and physical issues that require psychiatric medication and very expensive pain medication in many cases. And just to give you an example, I just did the math. I have 2 declawed cats right now that get buprenorphine shots. $150 for a 10-vial package. Over the course of a year, that cost is $2,735 and change per cat, not including the syringes. So this puts an extraordinary financial and emotional burden on those of us in rescue, too. It's not just the cats. Many of these cats are not adoptable, and sanctuaries like mine give them the forever home they should have had. The expenses continue for the rest of the cats' lives, but the much-needed donations that are few and far between barely make a dent in the long-term expenses. This takes a great financial and emotional toll on us. Sorry. Amputating cats' toes for the convenience of owners is callous, cruel, and is banned in the majority of countries in this world, as was explained before. This is Minnesota, and we have shown how strong and capable we are. If all these other countries have so much success in keeping their furniture intact and maintaining much lower surrender rates in their shelters, surely we can meet the moment and do the same here. I'm asking you to ensure that HF 1857 passes and goes forward with penalties intact. And as an aside, on the handout, on the website, I put in a PDF that has the profiles of a couple cats that have come through my shelter. And you can see their stories. They're all different. And every one of them is terrible. But if you can look and take a chance to see the color photos. This is Fergus, and I know it's hard for you to see him. He was 15 years old. He declawed. His family left him outside, and when he was found by animal control after being severely attacked by a dog, who he couldn't defend himself from because he had no claws, they said, no, we don't want him. Fortunately, I heard about him. I went and got him. And even though he didn't have a long life, he lived his best life. So I thank you for hearing me out. If you have any questions, I'm happy to answer any. and I appreciate your time here today. Thank you.
Is there anyone else in the audience who would like to testify for or against this bill? Anyone else in the audience? Questions from members? I have Representative Gottfried.
Thank you, Mr. Chair, and thank you, Representative Smith, for bringing this bill. It's not a question; it's just a comment, and I do apologize because we have a senior cat who was declawed by a previous owner, and Mr. Gaskin, the symptoms that you talked about, we're seeing in her now, and it's very difficult to watch her get pushed around by her sisters without having a means to defend herself. So I'm going to support this bill. Apologies, members, for getting emotional, but it's tough. Thank you.
Testifier.
I'm very sorry to hear about your cat and your family companion. I'm actually shooting myself in the foot because right now I hold practically the monopoly on the salvage surgery that might help relieve your cat. That's income for my clinic that I'm trying to get rid of, actually. There are new drugs out that you can discuss with your veterinarian, and the plethora of new drugs that have come out for pain control and for orthopedic issues has been amazing the last 3 years. Just throwing that, there's hope. Thank you.
Representative Harder.
Thank you, Chair Hansen. And Representative Smith, thank you for coming and talking with me about the bill. I appreciate that very much. And as we talked about the bill, I believe I had mentioned that a veterinarian in my area, questioned the bill because she had said that this is rarely done. It's sort of like a last resort, as we have heard. And I, too, have had cats in the past. And the cat that I had, the cat's name was Mercedes, because I wish I could afford a Mercedes. But she too was declawed, and that wasn't because I wanted the cat declawed, but it was because I was a renter, right? And the landlord was the one that said if you wanted to have a cat, it must be declawed. But I don't recall my cat ever having any problems after having that done. In this hearing sort of makes me a little squeamish because when my cat was declawed, I was actually in the room when it was done. So I can tell you that it's not for people to watch. And hats off to the veterinarians for all the work that they do. But in the end, I do believe that I'm going to agree with the veterinarian. I forget the person's name. That this is a case-by-case basis. And if someone wants to do this to their cat, I mean, while I wouldn't do it, should I be the one to stand in their way? It's really between the owner of the pet and the veterinarian to go through all the pros and the cons. And from the veterinarian that I know, she had said that before that this is ever taken into consideration, that they go through all these steps to avoid having a cat declawed. So I'm going to go, it's a case-by-case basis, and I don't want to be in between a pet owner and the veterinarian. So I apologize, but I'm not going to support the bill at this time, but thank you.
Representative Smith.
Yeah, thank you, Co-Vice Chair Harder. I do appreciate our conversation. Maybe I'll give one more shot trying to convince you. I will say I want to make clear that on lines 1.12 through 1.16, there's a specific allowance of this to be done to address an existing or recurring infection, disease, injury, or abnormal condition in the claws, nail bed, or toe bone that jeopardizes the cat's health. So veterinarians, if they see this as necessary, in their opinion, can still do this procedure under this bill if it passed. The other thing I would say, and maybe responding specifically to a previous testifier talking about how this is decreasing, that was true in the 90s. There's actually a chart here if you want to see. It went down quite drastically in the year 2000 to about 20% of all cats being declawed, and has actually stayed pretty static since the year 2000, and in fact has ticked up gradually in the preceding years. As I said, in that time, several states have noticed this not change, and that's why they have made the change, as have other nations. And maybe two other things I would say is, one is I'm very sorry to hear about Mercedes, but I'm glad that she had none of the negative impacts. In 2024, we passed a bill now that landlords can no longer require Minnesotans to declaw their cats. So we're starting to recognize as a government, generally in other areas, this is important, and I think we should do it now here just more broadly. The only other thing I would say is, I think there is a line that all of us would have when we talk about between a veteran and an animal owner, where there's something that is too cruel for an owner to be able to say, please do this to my animal. And so I think the question is, based on the research, is this one of those things that we say, no matter if people think they want to do it, they should not be able to do it? And the research, I think, is just really, really clear on, even if people don't realize it, they just think they don't want scratches on the carpet, or they're concerned about their new child. It's really harmful to cats, and this is the way that we can stop folks from doing this. Thank you.
Representative Harder?
Thank you, Chair Hansen. No, I don't have any other questions. Thank you.
I think we have a testifier wanting to comment.
Thank you, Mr. Chair. I'd just like to
If you could sit and then introduce yourself again.
Yeah, sorry.
I'd just like to respond to the last comment about the rates of declaws not coming down over recent decades. The Minnesota Veterinary Medical Association performed a survey of our membership last year and this year. We have over 2,000 members. Approximately 2/3 of our Minnesota veterinarians are in our membership. And I know it's hard to see from here, but this is a graph of when veterinarians in our state, our members, stopped performing elective declaws, either personally or their clinics stopped offering it. 2010 is here. You can see a huge increase in the number of our veterinarians no longer performing the procedure over the last 15 or so years. So an encouraging trend. I have more statistics on those numbers, but in general, as a summary, I would say currently about 30% of our veterinarians that are still involved in practice where that would be an option are offering declaws. 70% are not, but there's a huge discrepancy in the number of veterinarians who are 2008 graduates and younger or newer, no longer performing the procedure versus veterinarians that graduated before that. So we're seeing a definite trend with our Minnesota veterinarians in no longer offering or strongly discouraging the procedure. I don't know how that applies to some of our national numbers, but I think this is really important considering these are the people who this bill would affect. And we're seeing the type of change we're looking for through educating veterinary professionals and educating the general public and cat owners. Thank you, Mr. Chair.
Dr. Gaskin, you looked like you wanted to comment earlier, but if I missed you, I apologize.
No one's asked the question, what about the other 66% that don't show any clinical signs? We have a sentient, intelligent creature here. We've removed part of what they are, and their intelligence dictates that they conduct their own physical therapy. These cats that don't manifest the contracture that I'm talking about with the 33% that start in a painful manifestation of inappropriate elimination or biting or aggression, they actually stretch out their toes and they keep the muscles from cramping, and so they're not walking on their toes. And that 66% can get along just fine and look clinically normal and act clinically normal. It's that 33% over the 18 years of research that I came to that number from the number of declaws that weren't affected and what were they doing different. That's not in the paper, but they can manage it with their own physical therapy. But then some cats that have a lower pain tolerance or they're cramped up or contracted so much because of the rediscovery of the vinculum by Dr. Clarkston in the paper, they contract and they're painful. And that can happen anytime from 1 year to 10 years after the surgery. It needs to be recognized, and intervention needs to be done, because typically the scenario I see, inappropriate elimination in a declawed cat. First thing we do is we run a urinalysis. The urinalysis is clean as a whistle. So there's no urinary tract inflammation going on causing inappropriate elimination. Then we try the standard 30-day therapy of fluoxetine or Prozac as an anxiolytic. And that doesn't work. And then the owners of this declawed cat that wanted the quick fix for scratching decide, well, we've tried everything that we can on this cat, and that cat's ghosted from the clinic, undiagnosed, for the problems associated with the declaw that happened maybe years previously. We need to know how to recognize that and do appropriate intervention. Thank you, Mr. Chairman.
Representative Nelson, and then I was going to go to Representative Anderson to close. Representative Loris, Representative Nelson, and then to Anderson.
Okay, thank you, Chair Hansen. And I'm not sure if this is for the author or Dr. Menon, but I'm looking at line 1.12, the section D, the procedure solely for therapeutic services and or purposes, and just wondering what latitude do you how do you interpret that? And I think some of it is already. I think the education around this is, that it's a practice that's going away in a lot of ways, if I'm understanding from the veterinarian. But I'm wondering, as a veterinarian, that, if somebody is really saying, all right, this is, for what area would you look at as this is a therapeutic? What latitude does that give? Or, and then looking also at, on the penalty side of it, it's like I would hate to have a veterinarian perform one of these, under the belief that is a therapeutic purpose, and then come back and get fined for it because you didn't cross your T's and dot your I's, and so I don't know if that's a clear question or not, but maybe to the author first.
Representative Smith. To you, Tim.
Thank you, Representative Nelson. I think that's a good question. So one of the examples that was brought up a lot over this is if there's a tumor in that area of the paw, needs to be removed. There's a damage to the paw. They got run over by a car, and there's a particular thing that can be done. So there's a lot of latitudes. I'm sure we have two veterinarians here, so I'm sure they could go over sort of a laundry list of things. The nice thing about, I shouldn't say nice, I don't really know how to state this. The positive way of the civil penalties, of course, is that they are done through the board, which has veterinarian experts on it to go through each individual case, look at the law, and see if it has been violated. And I will say that this gives me a moment to talk about the civil penalties, because that's been some discussion, especially in the Senate, where there was some discussion about the actual civil penalties. In our law, generally, we're given 3 reasons for civil penalties to be given. One is to strip the economic advantage of violating some status. The standard cost for a declaw nationwide is about $1,000, with a range of $500 to $1,500. So that's why that first violation is only $500. Hopefully, if maybe unknowingly or accidentally they're caught, really the fine is only the amount that is the cost of the actual procedure, potentially less. And then, of course, it increases as you do more violations. The other 2 reasons are to discourage future misconduct, which of course I think we all want to do, even those testifying against this bill want to discourage this practice. And the third is to reimburse the board for investigation for just this purpose, so that it's not in the courts, it's a board of experts of this medical expertise that could do this. So I find this to be appropriate for this particular procedure, and we worked on this language to give a wide amount of flexibility for veterinarians who think it is necessary in this particular case to perform the procedure.
Representative Nelson. Representative Anderson.
Thanks, Mr. Chair. I'll be quick. I like the advice of Dr. Memon that consultation with the pet owner and looking at all aspects of the case and being able to use your judgment along with the pet owner. I don't think a ban is necessary as long as it's a declining practice and the two work together to do what's best for the cat. So members, vote your conscience.
Yes, thank you for listening to this bill. I feel very passionate about it, and thank you for members of the committee who have shown passion both in committee and outside for talking with me about this. I really do appreciate it. A couple of things that I just want to say again to reiterate for the record, especially because I really do appreciate the Minnesota Veterinary Association. I served on health a long time. Professional associations are very protective of their scope of practice, and I absolutely understand that. But also there are times where we as a legislature do have to step in, whether it's between different associations or for particular times where we represent our people. And I want to talk about, again, the most common things brought before this bill as I've been talking to Minnesotans and other associations. The first is safety of children and vulnerable family members, the elderly. Honestly, declawing cats make them more dangerous, which is why the CDC, as was mentioned, does not recommend this. Neither does the Infectious Disease Society of America, because bites are much more dangerous for those who are potentially immune compromised, who are elderly, than trimming their nails or other options for cats. There was also a reference of potentially increasing pet surrenders or increasing euthanasia. That has no peer-reviewed data to support it. In fact, there's peer-reviewed data to refute it. In British Columbia, which is one of the provinces in Canada that has this outlawed, they did a study for just this reason in the 3 years prior to when a ban was passed and the 3 years after the ban was passed. And there was no change, both in the euthanasia or in the surrendering rate of cats from previously. That matches with data in our country in cities like Los Angeles that have also banned this practice. And, finally on sort of the government overreach in veterinary care, simply to say, as was mentioned here, 30% of veterinarians in Minnesota still do perform declaw surgeries, which is a large amount of vets. And that also means other vets that are not offering these services if they refuse the service, they might not just lose that potential client because they refuse that particular service the client wants or potentially telling them something they don't want, but also that cat is still going to potentially get declawed elsewhere. We have veterinarian students who are graduating not knowing about this procedure and feeling very negatively about this procedure. We've talked to some of them that now work in clinics that offer this and feel incredibly morally dubious, to say the least, about this and are struggling with burnout just because of things like this being allowable. I think it is our duty as representatives to push this through. So I do truly almost beg you that we can send this through to judiciary. Let's alleviate cat suffering in Minnesota. Thank you, colleagues. Aye.
Been called for. We'll test the division by a show of hands. All those in favor, raise their hands. All those opposed, raise their hands. Seven, the motion is tied. The motion does not prevail.